Hey y'all, happy Friday. Let's see. Happy Friday. How's everyone doing? Let's see. I'll start in like a minute. We'll start like 5:02. All right. Hi, everyone. My name is Ibuku, and I am the social media program outreach coordinator here at Whitman-Walker. And happy Black History Month. Just to start off with that. Throughout this month, you're going to see us come on the platform and talk about several different topics regarding Black history, Black healthcare, Black LGBTQ folks, women's health, Black women's health, really just like everything we want to talk about, just like a lot of things on the platform. So today, like I mentioned, we're actually going to be talking about Black LGBTQ healthcare heroes. So today I wanted us to discuss the history of Black LGBTQ healthcare. So like really how it started, where are we at right now with it. And also I wanted to talk about why it's important for organizations / health centers and also ourselves as individuals to remain inclusive of Black LGBTQ individuals when providing patient-centered care. And finally, I wanted to end us off by highlighting and sharing individuals and organizations that have devoted their time to improving Black LGBTQ healthcare, both present, people doing it right now, and also people in the past, people who kind of like paved the way for the people that are doing the work at this very moment. So I hope that sharing this information will serve as an example for those watching. So another reason why I feel like this is really important for us to talk about is while I was doing research on really what is Black LGBTQ healthcare, I kind of like had a hard time finding any information because people don't research it. It's very under researched. There's not a lot of funding. So I just feel like us having this conversation today is helping amplify the need to do this type of research. And hopefully in the next decade or so, we have more scientists, more researchers actually devoting time to this. And finally, I just want to say thank you to all the African American providers, our personal healthcare heroes at Whitman-Walker, who are addressing health disparities and finding ways to navigate the barriers faced by our Whitman-Walker health clients as they navigate the healthcare system, which we know is super difficult to navigate. So we just want to say that we see you and we appreciate the work you do on a daily basis. So about 12% of the LGBTQ plus community actually identify as Black. So Black queer individuals actually face similar health problems as their white counterparts. But oftentimes, these challenges are at a higher rate due to systemic inequality. So some of the obstacles faced by the Black LGBTQ community include lack of comprehensive healthcare insurance, access to equitable and safe jobs, and also they face the challenge of lacking a secure social support system. So health outcomes for the Black queer community tend to be worse than that of the white, Hispanic, or Latinx community. So healthcare systems need to recognize the unique challenges faced by Black LGBTQ people while seeking medical treatment. So for example, some of these factors that play into the poor health outcomes for Black LGBTQ individuals are stigma, discrimination, violence. So it's also important to note that Black LGBTQ individuals face multiple intersecting structural adversities that can be linked to sexual orientations, gender identity, socioeconomic status, education levels, and racial identities. So already as racially marginalized people, they're already facing policies and systems as they try to gain access to things like housing, healthcare, and places of leisure. So we live in a heteronormative society, which ultimately ostracizes anyone that does not fit in this norm that's been created for us to abide by. So this includes the Black LGBTQ community. So oftentimes, people in the Black queer community face shame and stigma. So not only from their immediate surrounding community, but they can also face this when seeking medical treatment. So an example of this can be found when an organization that is created to provide a safe space. It's supposed to help increase visibility to the LGBTQ community. If this same organization refuses to give honor or kind of like advocate for the issues of race and ethnicity, and they also continue to ignore to focus on anti-racism efforts, this is not a space that the Black LGBTQ community may feel welcome. So ultimately they're kind of being like gatekept from like using this healthcare facility that was created for them. So another example of the dynamic of interpersonal relationships between Black LGBTQ individuals and their community can be the different ways people choose to interact with them. So for example, a family member can say, "Oh, I'm going to help you if you are facing any stress based on your race." But then they say, "I'm not going to help you because you happen to be queer." So this can also show up in an interaction with a coworker. So if a coworker is able to relate to a Black person's LGBTQ identity, but will still continue to engage in racial microaggressions. So these type of intersecting identities often cause harder interpersonal relationships between the Black queer community and the people around them. So all these negative interactions signify the importance of creating a system that caters to the Black LGBTQ community in healthcare. So we do have a few suggestions of things you can do as an individual, as well as suggestions for institutions. So first, it is important to increase the awareness and integration of the lived experiences of Black LGBTQ people. So one, it's great to read a book, it's great to listen to a podcast, it's great to attend a cultural sensitivity/competence training, but that is simply not enough. It is imperative that when having these conversations, you're including the real voices of Black queer individuals at the table. So that means instead of having someone else that doesn't identify as a queer individual speaking about them, you want to kind of create a seat at your table for Black queer individuals. So another suggestion that we have for both individuals and institutions is to address the messages and ideas that we've been subscribing throughout our lives. So unfortunately, we all know the healthcare system is one that was built on racism, sexism, prejudice against certain groups of individuals, which also include the Black queer community. So some questions we urge you to ask yourself, and also if you work at an institution, some of these questions can be, one, how is our institution experienced by Black queer people? Have we even bothered to ask them? Another question can be, does our institution have an explicit mission on serving Black queer people? Another question we suggest is, do I listen to the voices of Black queer people? Are they part of the conversations? And a final question that we have for you to kind of like do some self-awareness, or if you're with an institution, is say, do I or my institution take a public and internal stance on a national, regional, local incidents that are relevant to the lives of Black queer people? We find that one especially important because it's a different thing to have a public opinion on, or not opinion, a public stance on injustice that are occurring around, but are you also doing things internally to prevent your clientele, your patients, your friends from, being affected detrimentally? So we believe that those are really important questions, and they can really help, have us start thinking about really what's going on. So finally, that we've kind of talked about like the history of Black queer healthcare, I wanted us to just kind of talk about some heroes who have paved the way and continue to do the work that is often neglected, unfortunately. So the first person I really wanted to talk about is Phil Wilson. You might already be familiar with Phil Wilson. So in 1999, he founded and he's the current director of the Black AIDS Institute. So as a Black gay man living with HIV, he spent the majority of his lifetime researching ways to better educate African Americans on HIV/AIDS and also how they can better educate themselves and stay safe. So like I mentioned earlier, when I was doing research on what does Black queer health mean, like what is going on, I happened to stumble a lot of his work, and I mentioned that there was not a lot of other people doing the work. So he's really someone who is really paving the way and showing that, this is an important field of study, and it's important and people are going to benefit from it. So the Institute's mission is to stop the AIDS pandemic in Black communities. Another person I wanted to talk about is Dr. Jonathan Lasseter, and he's an assistant professor of psychology at Rowan University. One important thing about him is he's the author of the book. It's called Black LGBTQ Health in the United States, the Intersection of Race, Gender, and Sexual Orientation. So through this book, he has amplified the voices of Black LGBTQ people working in the health field. His work is important because, like I mentioned before, most research on the Black LGBTQ community is not done. And when it is done, it's not done by people who are either Black or queer. And another cool thing about his book, which I did happen to read before, he really, he's talking about intersectionality and how as a Black individual, especially as a Black queer person, you just have so many opposing oppressions kind of going against you. So his book really helps kind of spell it out and really just enlightens you about really what's going on. So I think that it's a pretty hefty book. I'm not gonna lie, it's a pretty big book and lots of words, but it was very, very interesting, especially if you're interested in working in Black queer healthcare, or if you feel like you're going to work with patients in that field. And the final person I wanted to talk about is Dr. Oni Blackstock. So she's honestly someone I really look up to because of the work she's doing. So Dr. Oni Blackstock identifies as a queer Black woman, and she's actually a primary care physician who specializes in not only primary care but also HIV. So she was an assistant commissioner at the New York City Health Department, where she led the city's response to the HIV epidemic. I really got to learn about her through her Twitter presence, where she uses social media as a tool to educate individuals about HIV. And as of recent, she's been doing a lot of talking about the COVID-19 pandemic and how that's affecting other people. Currently, she launched her own health equity consulting practice called Health Justice, which has a focus on supporting healthcare, public health, and anti-racism and equity in the workspace culture. And she also has a specific focus on LGBTQ health and the health inequities in these marginalized communities. So those are basically all the healthcare heroes I wanted to share with you all today. Throughout the rest of the month, I'm going to come on and share different healthcare heroes, including the healthcare heroes we have here at Whitman-Walker. So I hope you find that informative, and at the end of the month there might be a trivia, so definitely remember everyone I've been talking about and all the cool things they've done. But yeah, that's all I have for everyone today. As usual, if you have not received your COVID-19 vaccine yet, please call us at 202-207-2480. We're always willing to talk to you and schedule an appointment for you. And if you have a hard time reaching out to us, you can call, or you can actually go on the website vaccines.gov, and that is a cool database, and you can just find the nearest vaccine appointment to you. But as usual, please follow us on TikTok, Instagram, Twitter, Facebook, and you can call us if you have any questions about anything related to healthcare. We love to talk about healthcare. But yeah, it was nice talking to you guys about our heroes for today, and I will see you all next week. Bye.